Well, good morning, everyone. Welcome to another seminar as part of CAPRA's curriculum series for ADRD researchers. I am Matt Davis. I'm a professor in the School of Nursing and a member of the CAPRA leadership team. Today, I'm very happy to introduce Dr. Edward Norton, who is here to present on entropy balancing. Dr. Norton is the United Healthcare Professor of Healthcare Management and a professor at the School of Public Health in Health Management and Policy, as well as of the Department of Economics at the University of Michigan. He is the Director of Quantitative Analytics in the Center for Healthcare Outcomes and Policy and a Research Associate of the National Bureau of Economic Research. Dr. Norton's research interests include econometrics, long-term care and aging, and pay for performance. On CAPRA, we're lucky to have Dr. Norton as a member of our leadership team, where he leads the pilot core, along with Deb Levine and Christine Arush. And now I'll turn it over to Edward for his presentation. Welcome.
Thank you. Good. I'm going to start by just admitting right off the bat that today's talk has nothing to do directly with Alzheimer's disease, related dementias, but hopefully for people who do any sort of quantitative methods, this will be useful in your research. So that's the hope here. I'm going to talk about entropy balance. So suppose that you want to compare outcomes between two groups, such as, do we need to stop?
It's the microphone.
Yes.
Okay, thank you.
Yes, it's on.
Thank you.
The green light's on.
Thanks. Sorry to interrupt.
So suppose you want to compare outcomes between two groups, say smokers and non-smokers, or those who get a new drug versus those who get a placebo, dual eligibles versus non-duals, those who get robotic-assisted cholecystectomy or laparoscopic cholecystectomy, or perhaps those who have a diagnosis of ADRD versus those who do not, and you don't have a randomized controlled trial. How can you do the best job possible of comparing those two groups with non-experimental data? And so many people turn to some form of matching. And so the idea of matching is we want to compare likes to likes. We want to compare as closely as possible groups that are closely matched. And I really want to focus on this slide and make sure that the motivation behind this makes sense, because a lot of the questions that I get about entropy balancing later sort of forget what the goal is. Okay? So the goal here is not just to compare likes to likes, but more importantly, we want the controls that we're comparing the treated to be as similar as possible in all dimensions. So except for, of course, the receipt of whatever the treatment is, whatever treatment broadly defined. It could be a drug, it could be a type of surgery, or it could just be comparing two groups that one has a disease and the other does not. But you want all the other covariates, all the other things about the two groups to be as similar as possible. Two other more specific ways to explain this is, one, we want balanced covariates. So think of a table one of summary statistics. And so you have summary statistics for the control group, summary statistics for the treated group. We want those summary statistics to be as close as possible, right? And if they are the same, then we say we have good balance covariates. Another way that I like to think about this is what I call a randomized controlled trial property of running a regression. So let me try and explain what that is. And first, let's think of the perfect RCT, where you have unlimited budget and you can do exactly what you want. You want to test the effectiveness of some new drug. How would you design this experiment? Well, you would want to get a group of people, or rats, say, you get rats that are identical in every dimension. So the rats, each pair of rats would have the same age, the same gender, the same fur, the same comorbidities, the same insurance, right? They're going to be exactly the same. You line them up like Noah, and you pair them off, and then you give one the pill, the drug, and the other you don't. And so you match pairwise, flip a coin, and give one the treatment and the other not. And why do we want to do this? One way to think about this is this really nice property. If you have perfectly matched RCT, is you can then run a regression of your outcome, whatever that is, usually denoted Y, is a function of just the treatment. Or you can add in additional variables into the regression, age, gender, comorbidities, insurance, and so forth. If you have a perfect RCT with perfect matching, it doesn't matter if you include the other covariates. Okay? There are a couple ways to think about this. One is that in this perfectly matched RCT, the covariates are unrelated to treatment because they're matched perfectly and treatment is one or the other. And so they are statistically independent, they're orthogonal. And so it doesn't matter if you leave them out, they're not confounding. Okay, and that is a beautiful thing about an RCT. And so this nice property is that it doesn't matter if you include the covariates, except for standard errors. Standard errors change a little bit, but the coefficient will not. Okay, and so what we're aiming for here is matching likes to likes. We want a balanced table of covariates, and we want this RCT property where we get the same thing, whether we include the covariates or not. So there are lots of types of matching. If you've done a lot of empirical work, you're probably familiar with some or most of these. The easiest one to think about is this exact one-to-one matching where the characteristics of this control observation are identical to the characteristics of the treated observation. And that's easy to think about. It's like what I just told you, but really hard to do in practice with real data, because if you try and match on more than about two things, it's very hard to find exact matches in your data. You typically lose a lot of sample size. So to get around that, people have created sort of approximations to that: coarsened exact matching, nearest neighbor matching, wonderful names for basically saying we'll do a decent job, but not as good as one-to-one matching. Okay, and so there's some trade-offs there with, like, how close a neighbor do you have to be, how coarsened, how close do you want to be, and so there are trade-offs between getting the covariates balanced versus losing observations because there is nobody nearby. Propensity score analysis, I assume people are fairly familiar with that. What it does is it takes all the covariates, it creates a single index, a single number. How likely are you to be in the treated group or not, as a function of all the observable characteristics. And then given that score, there are kind of two ways to go. One is you do some sort of matching based on this index, on this number, or there's something called inverse probability weighting, which is done. Okay, that's all I'm going to say about matching, because my goal for today is that after today, you will never do these again. Okay? And so there's really no point in going into the details. We're going to talk about entropy balance. Why am I kind of down on all these other matching methods? They actually are very good in moving towards where we want to be. They do a reasonably good job about getting us to compare likes to likes, about improving the table of summary statistics, but it's never perfect. And so there are all these decisions, if you do propensity score matching or anything else, about which observations to keep. You typically drop observations, sometimes treated, often controls. The matching is never perfect. You never get perfectly balanced tables. You get closer, that's good. And so you have smaller sample sizes, not representative, larger standard errors. We could talk about the trade-off between bias and variance. As you get smaller sample sizes, you get a better and better match, but then you're less representative. Issues about generalizability. Anyway, it's not perfect. And that is going to be a compare and contrast statement with entropy balance. The other thing I want to emphasize is if you read papers that do propensity score balancing and then try and reproduce what they do, it is really hard. No matter, and simply because there are a lot of what I call artistic decisions about what happens in any propensity score matching, which variables to match on, but then there are issues about binning and distance measures and trimming and overlap and sample size and what happens when your inverse probability weights are really big or really small and do you drop, like it's really hard to reproduce what somebody else has done, and reproducibility is a desirable goal. So now we're going to move on and just talk about entropy balance. So in 2012, Jens Heinmuller published this paper in Political Analysis that has almost 7,000 citations, and the number of citations is just, it goes up year over year by a lot. He's a political scientist now at Stanford, and this has been a method that has been growing in popularity for very good reasons. And in my view, this completely dominates any other type of matching you might want to do. So I have not yet found any downside or any situation where I'd ever consider doing a different kind of matching over entropy balance. There are situations when nothing's going to work, but I haven't seen a situation where entropy balance fails and the others work. Why? One, we're going to get exact matching on table one. And by exact, I don't mean close, I mean exact matching on the means and the variances and any skewness. We will get exact matching on the summary statistics. Second, we get to keep all the treated observations, don't lose anything. There really aren't artistic decisions to make beyond which variables to include in the modeling, and that's usually pretty straightforward. And therefore, it's very easy to reproduce. And also, because of the exact matching on table one, it allows us to have this nice RCT property of running a regression where it doesn't matter if you put the covariates in. And it's easy. It's really, the only hard part is explaining it to people who haven't seen it and say, well, but I know how to do propensity score. I understand nearest neighbor matching and it's different and I don't want to learn something new. That's the hardest thing to get over. And so that's what we're going to try and get over today. All right. What assumptions do we need? We need what's called common support. We need overlap on the covariates between the two groups, as you would for any other matching, okay? So unless you have really bizarre cases where you're comparing babies in the treated group with elderly in the control group and there's no overlap on age, in most situations, we're going to have overlap, it's going to work. And we don't, the beauty of this is we're not going to have to match this observation with this observation. It's more of a collective thing where overall we're going to match on the means and variances. So just a quick reminder, we're going to take a moment to talk about statistics. The mean is just take a simple average, we add up a bunch of numbers and divide by the number of things, and that is the mean or average. The variance looks at the difference between the observation and the mean, takes the square of that and takes basically an average. Skewness is the third moment. It's the cube of that difference normalized. And these are and you can keep going. There are an infinite number of moments. But what we typically care about in terms of matching distributions is the mean variance, and perhaps skewness. So for continuous variables, we are going to want to match not only the mean, but also probably the variance and skewness. Okay, so how does it work? It works by creating weights, a different set of weights for the controls. It's just going to take a weighted average of the controls such that the characteristics of the controls are then going to match the treated group. So what it does is it creates weights. Now, if you don't do anything in particular, all weights are equal to 1. Like democracy, everybody gets a vote of 1. What entropy balance is going to do is find a set of weights such that basically table 1 has all the right properties. Okay? So the details behind that I don't think are important to go through today. I'm happy to talk about that later if you want. But what it does is two things. One is finds weights such that the means of the weighted controls match the means of the treated group, as well as the variances and so forth. And also, typically there are an infinite number of combinations of weights that will have that nice property. So among all of those possible weights that get us what we want, we're going to choose the weights that are closest to equal, closest to 1, 1, 1, but are typically off from that a little bit. Where does the name entropy come from? It comes from physics. And entropy in physics is a measure of disorder and randomness. And the way I think of this is that when you have weights equal to 1 for all observations, every observation gets to have equal weight and is not compressed to 0. That would be the maximum entropy. And so what it's doing is sort of maximizing entropy, meaning having the largest values across the entire sample closest to 1, such that it still gets us a weighted sample that gets us what we want. That's my understanding of where the name entropy balancing comes from. Okay, let me give a really simple example of how one might come up with entropy weights. For a trivial example, suppose we have 3 treated observations and 3 controls. The ages for the treated are 30, 40, and 50, average is 40. The controls are 20, 40, and 60, also an average of 40. There are a lot of weights we could use such that a weighted average of those 3 numbers gets us back to 40. For example, we could use weights of 1.2, 0.6, and 1.2. If we multiply these 3 numbers by those 3 numbers, we will get 40. We could use 0.9, 1.2, and 0.9, or various other there are lots of combinations of weights that will get us an average of 40. But out of all of those possibilities, we can also use 1, 1, 1, the very simple average. This has the greatest entropy, and so we are going to use that in our entropy weight. So we end up not really changing anything in this trivial example. But that's, there are many possible combinations of weights. We're going to use this to match those. That actually won't balance the variance that would require something else. Yes?
When it says like and closest 1, is that like an average, like you have 1, 1, 10,000, or if you had 5,000, 5,000, 5,000, making this up.
Yeah, yeah, so it uses maximum likelihood. There's a function. I don't remember exactly how it does that, but it's going to have an overall. It has a way of deciding sort of what is closest to 1. Sorry, the question was, how do you decide what closest to 1 means? So, okay, So hopefully now you're excited about this and want to do this. So I'm going to go through this quickly because I don't know anything about SAS, but there is a command in SAS, there is a command in R, and there is a command in Python. So if those are your softwares of choice, there are ways to do it in that. I'm going to talk briefly about Stata because I know Stata and I know many others use Stata, so I'll mention it briefly. And there are a couple little things that are important to keep in mind. So the Stata command is called eBalance, which sounds like a dating app for Stata users, but it is a command. And you can download it by saying ssc install eBalance. And what you do is you list your binary treatment variable and then all the variables you want to match on. In this case, I want to match on 2 binary variables and 1 continuous variable. Then the comma. Targets is how many moments do you want to match on? For binary variables, you only have to match on the mean. And if you match on the mean, you get all higher moments for free. So you just need to do 1 for the binaries. For continuous, I usually go to 3, just a little bit overkill, but why not do that? We're going to generate a new variable, which are the weights, which is what we're going to use later. So we want to hang on to those. You can give it a name, whatever you want. And then it turns out that in practice, if you don't say tolerance, the level of matching may not be super exact. So I tend to force Stata to do more iterations of the maximum likelihood and get us a more precise matching on all the moments. And then we do that, and then we can run our regression of whatever the outcome is on treatment and perhaps these variables or not. And then you would include p-weights equal, and so this name has to match that name, okay? And that's how you do it, and you're done. And the only real decision here, the big decision is which variables you want to control for. That's usually obvious. And if you do 1 for the binary and 3 for continuous, that's what you want to do. Yeah.
Just think like with my background is that I have this propensity like scores. Like when generating propensity score, there's a lot of debate. Like you use a high dimensional propensity score, you use it with a parsimonious model differently. There's a believe in like are you truly opposite of the spectrum? Is there some thought here like entropy should only be on things you think are associated with treatment, or it's like if you've got 10,000
everything
variables, but 10,000 variables is better?
Well, if you have 10,000 variables, you better have a heck of a lot of observations.
Oh, yeah, it is.
Yeah. So, I mean, there are certainly situations where you run into sparseness and you're over predicting and you can't actually match on everything if you have too many variables. But in most situations, it's basically what would you put in the regression? Okay, assuming that you're aiming to run a regression here, anything you put in the regression, you would put in that.
The benefit of putting like, let's say you gathered, I guess like if you have, let's say you have 100 variables in a survey or whatever, you have 100 variables in your claims data set. Some of them you don't think are going to be associated with your ultimate outcome that the treatment's going to act on. Should you still include that? Is it like just you have the variable, you have the number of observations?
No. So again, to repeat the question is which variable should you include in the entropy balance? And I would include what you are using in your analysis. You don't include all the other random stuff that's not really part of your study. Yes.
There's a question from June in the chat.
Yes.
Why is it necessary to include the covariates in the regression if the weights are included?
So in this, the only reason you would do that is to get smaller standard errors. So again, we'll show this with a particular example in a moment, but should you include the covariates in your regression if you have the weights? The answer is partly it doesn't matter because the coefficient on treatment will be identical, and partly it does matter because the standard error will be different. With covariates, they soak up variation. The root mean squared error is smaller, the sigma squared, the error variance is smaller. That feeds into the standard errors. And When you include covariates that soak up, they improve your R squared, that gets you smaller standard errors. So that's the reason to do it. Okay. Yes.
Yeah. Knowing the two sides. Thank you. Yes, much.
Okay. And these slides are available if, okay. So that's why I put them in there and then we're moving on because I can't answer any more questions about that. Let's do an example, okay? And in this case, we're not going to match on dementia or Alzheimer's. We're going to match on smoking. The outcome here is birth weight of a baby. And so the question is, does birth weight depend on mom's smoking or not? And we're going to have a bunch of confounders. So let's see how this works. All right, raw data here, we have birth weight split out by non-smokers and smokers. And so visual statistics shows that the weight of babies born to non-smokers seems to be a little bit higher than to the average weight of babies born to smokers. Okay, this could be smaller babies or smaller babies conditional on gestational age, which might be lower. We don't have that information. By the way, this is a Stata data set. You can download this and reproduce everything. If we just look at the simple difference in weight by non-smokers versus smokers, we get a difference of almost 300 grams, 274 grams. The mean weight for non-smokers is 7.5 pounds. If you prefer to think imperial weights, this is just under 7 pounds. The difference here, 274 grams, is about 10 ounces, to use a third measure of weight in the same slide. So we have 10 ounces on average difference in birth. That's a huge amount. That's more than a cup, right? So that's a huge difference. Now, we know that smokers and non-smokers are different on all sorts of characteristics besides smoking. So, and some of these things may well also be related to birth weight, and so we're worried about confounding, okay? So let me show you an example of how they're different with 4 binary variables. So is the mother married? Is it their first baby? Did they get prenatal care in the first trimester? And do they drink alcohol by some sort of alcohol measure? And we see differences across the board. Smokers are much less likely to be married, less likely to have a first baby, at least in this data set. 10 percentage points less likely to get prenatal care early on, and much more likely to drink alcohol. Okay, so those are differences. We think those may matter. If we do entropy balancing, let's think about this as the table 1. Without weighting, this reproduces what we just saw, but also with variance and skewness. And we see these do not match without weighting. Here I've created entropy weights for the binary variables as the weighting variable. And here we'll see that we get the same mean, variance, and skewness. Okay, so we can match those. Things are off in like the 4th decimal place because I didn't get the tolerance quite deep enough, but these are basically the same, and I could rerun it to match them even better. Okay. What happens then when we run a set of regressions? So this is the simple regression with just the dummy variable. This reproduces the simple mean difference between smokers and non-smokers of 274 grams. We can run sort of a typical regression without any matching and just throw in those 4 dummy variables. And we see that these 4 things do seem to affect birth weight in some way. In particular, marital status is highly related to that. We can do entropy balancing and not put in the covariates. We can do entropy balancing and put in the covariates. And as I predicted, the coefficient on treatment, smoking in this case, is numerically identical. The standard error is slightly smaller with covariates. So this answers June's question of why do we we want to put in these other covariates, we get slightly smaller standard error. It doesn't really make a big difference in this case. But because the adjusted R squared is relatively modest here, at only 0.04, 0.06. Okay. So this demonstrates the use of entropy balance for 4 different binary variables. We can do a similar exercise for some continuous variables, mother's and father's age, mother's and father's education. These are all continuous. And we see that they don't match. For education, the mean for the, these are the smokers. The mean for the smokers is more than a year lower than for the non-smokers. After entropy balance, we get not only the mean, but also variance and skewness are identical across the board. Okay? So just reweighting the sample of controls, taking a little more of this mom, a little less of that mom, we're able to balance these. Okay? And then again, when we run regressions, this is the simple regression we got before. This is the regression that throws in these 4 continuous variables. This is with entropy balance and no covariates, entropy balance with those 4 covariates. And again, we match perfectly on the coefficient on treatment, and we get, it's about the same standard error. We're not, these variables aren't actually doing much here, so the standard errors don't really change. But in principle, if you add variables that explain a lot, then the R squared will go up and this standard error will go down. Okay, so again, just for Stata users, it's 2 lines of code. You run eBalance, you generate a variable that you then use later with probability weights. Okay, and that's all you need to do. I want to go through 4 advanced topics on this now that you're all experts on the basics, okay? And this gets a little bit into the question we got earlier about sort of how many variables do I want to throw in? And so my first answer is, well, you put in whatever you would do in the regression. And sometimes in regressions, we not only say want to control for, let's say, age and marital status separately, but perhaps their interaction. Perhaps we think that the effect of age differs for married and unmarried women, perhaps. You can absolutely do that with entropy balance. And in Stata, it's easy to do with the double hashtag command. This creates an interaction on the fly and will create balance not only for age overall, not only for marital status overall, but it'll match age, the moments of age for married and for unmarried. And you could do this for other things. You could do this for education and insurance status and their interaction, for example, and it will do everything. Again, there could be a case if you put in too many interactions with too many thousands of variables, you would eventually run into small sample sizes. But in general, that's going to be working.
I thought that it's thinking like as maybe relates to the other one. Like I was noticing, like before we move on, I said I didn't want to say it. I think we addressed. But I'm curious, are there like cases where doing this entropy balance will give, like it will be much better than doing like regression? Like are there certain cases where like in like rare events may be better, like certain propensity disorder regression in those versus whereas like tons of events and lots of data that probably end up emerging. Is there
right?
So
the question is are there cases where entropy balance is better or perhaps worse than just running a regression? So just to make it clear, either column 3 or 4 compared to column 2. Is that what you're asking about?
Yeah, because I'm seeing like a big jump from like not controlling for anything to controlling, and then I begin to wonder, like I know this isn't the point here, but like like the ability, like some
Yeah.
variation in weight is gonna be like, did they put a little
What-
owl in it?
When I presented this at CHOP, Justin Dimmick asked exactly that question, so you're in good company. And this is true of a lot of things, is do we really gain much from going beyond standard regression where you throw in a bunch of controls? Now, this is one example, okay? So let's not extrapolate based on exactly one example. But yeah, this is like, and you could ask the same for any matching. How much does this really improve over any other kind of matching? Or how much does it improve over just running a regression? Okay. And this is where I go back to that slide at the beginning. Why are we doing this? If your goal up front is, okay, I want to do the best job possible with observational data, and I want to match, including comparing likes to likes, then entropy balance does that. And it does it in the simplest, cleanest way you can possibly imagine. It may or may not be that different from other things, okay? One of the things is we're going to have the same sample size here for entropy balance in a way that we often will not for other forms of matching, and that is a clear win, okay? Compared to regular regression, okay, it takes one more step. It's a little more complicated to explain. But I would argue that, if you have a binary treatment, I would do entropy balance over just standard regression because we're getting a better match, okay? And I don't think that asking, well, does it make that much different? I don't think that's the right question to ask, okay? What is our goal? Our goal is to compare likes to likes, okay? Is to reproduce a randomized control trial as best we can, given that we don't have a randomized control trial. And this is going to do it. As my friend and co-author, Partha Deb, who's an economist at Hunter College, said when he learned about this, like, we should do this all the time, right? So I want to make sure you think about that early slide. Why are we doing any of these things? Entropy balance gets us as close as you can possibly get. Second, treatment effects. So briefly, because either you've seen this before, you haven't, but in the causal inference world, people talk about treatment effects average treatment effects on the treated versus average treatment effects on the untreated, and sometimes some other things. One of the nice things about teaching entropy balance is it really makes clear the difference between average treatment effect on the treated, which is what I just told you about, reweight the controls so that they collectively look like the treated. And then to the extent that you can think about this as causality, which is dicey, wait 2 slides, we can think of this as like an average treatment effect on the treated. You can actually do the opposite. You can reweight the treateds to look like the controls. Why not, right? We could just redefine things, reweight the treated, look like the controls, and then you get an average treatment effect on the untreated, okay? So, and having run that, we get slightly different numbers. Conceptually, they are slightly different. They are different populations. You would expect to get slightly different numbers in this particular example. They answer different questions. Third advanced topic, can you use it with logit? Absolutely, yes. This works exactly the same way. You do E-balance, you create weights, then you run logit, use P-weights, and we're done. But there's a but. The RCT property that we talked about, where you get exactly the same coefficients, that no longer holds. Because when you run a logit with the extra covariates or not with the covariates, you are changing the root mean squared error. And when you change the root mean squared error, you change sigma. And when you change sigma, you change beta over sigma. And what does logit actually estimate? It estimates beta over sigma. That may or may not have made any sense. Next year, if you want, I can talk about logit and odds ratios and why you should never estimate or report odds ratios, because most people don't know what they actually mean. If you're very familiar with it, then entropy balance is just another way of reinforcing my point about odds ratios. When you add or subtract covariates that are not confounders in a logit, you will get different parameter estimates on treatment in the logit. You get different odds ratios. But the really cool thing is the margins will stay exactly the same. The marginal effects will stay exactly the same even though the odds ratio differs. And if you want to know more, you can read any of these, all these papers, or talk to me later. Odds ratio are another pet peeve of mine. Okay. Moving on, because we're starting to run out of time. The last point is this does not get us to causality. Okay, we cannot engineer our way out of not having a randomized control trial if you really don't have a randomized control trial. This is about dealing with observational data in the most graceful way you can, but still understanding that you probably don't really have a true experiment, okay? So it does not solve all your issues, but to the extent you want to move closer and do the best job possible of controlling for all your observable characteristics, this will do the best job possible, okay? But don't think that this automatically gets you to causal inference. So it can balance on all observed covariates, but it's not going to get you all the way to causality. Okay, so in conclusion, use entropy balancing, okay? That's all the other matching methods have various problems, dropping observations, not perfectly matching table 1, lack of reproducibility or hard to do reproducibility, various artistic decisions. Entropy balancing does do all the good things, and it gives you a happy smile on your face, as I can see as I look around the room. Okay, so this is, that's my introduction to entropy balancing. I've already got lots of people over at CHOP, and the analysts are all on board on this, and it really, I think, is the way to go in the future. So thank you very much. Happy to take questions.